The CDC says suicide is now the 11th leading cause of death in the United States.
Experts say the death rate has gone up by 32% over the past 2 decades, with the sharpest increase happening between 2020 and 2021.
For more, let's bring in Chief Science Officer for the American Psychological Association, Mitchell Prinstein. Mitch, thanks for joining us. The U.S. suicide rate had been declining for 2 years before returning to a near record high in 2021. Do we know, Mitch, is there any insight into what caused rates to increase?
We can never be sure, but we know that suicide usually follows significant stress. And there's certainly been plenty of stress between the pandemic and the remarkable polarization that we're seeing, particularly in our country.
Mitch, we know that depression and suicide, that can impact anybody, but are there particular groups that are most at risk for suicide?
We really have to keep a lookout for those who identify as Native American. We're seeing a big increase in suicide among African Americans as well, Latinx and white Caucasians too. We're seeing lots of suicide in those groups. We want to think in particular about youth. Suicide's been the second leading cause of death for those ages 10 to 24 for many, many years now, and those rates unfortunately are increasing.
You know, with that in mind, right, as a parent, you look at these kind of statistics and you wonder what needs to be done, specifically with respect to youth, right? What is it that you think should be happening at the state level, at the federal level, at the local level to prevent suicide?
At home, we have the talk about sex, we have the talk about drugs, we need to have the talk about suicide with every adolescent. Every adolescent, either they or someone they know very closely has thought seriously about suicide. So let's talk with them about how to be prepared and think about it. At the school level, we should be screening all kids the way we do screenings for hearing and vision to see if they have any risk factors for suicide. And at the legislative level, we really need to make sure we are doing far more to create a mental health workforce, especially one that looks like our country, so we can ensure that we have enough people to protect kids when they start experiencing distress.
Mitch, you know, we are talking about this more, but there is still, as you mentioned, there's still a stigma out there. How do we break through that?
I mean, the stigma comes from the kind of work that was done literally hundreds of years ago, thinking that our physical health and our mental health were two separate things. They're not. These are all interconnected, and we need to be talking about them pretty openly so that way we understand that mental health is a concern that affects the vast majority of us at some point in our lives. So let's start treating it with the same way we treat physical health issues.
Mitch, just one more for you. I think because there is that stigma that we've been talking about, there's sometimes a hesitancy for people to raise this issue with folks who they suspect might be contemplating suicide. In other words, some people might be scared that they would put an idea into someone's head. How should people go about actually opening up a conversation like that if they feel that someone that they know, someone that they love, is contemplating this?
I'm so glad you asked, because research clearly says that talking about suicide doesn't make someone more likely to consider it or engage in suicidal thoughts, but rather it's usually a relief that someone has created a safe space for someone to be able to express how they're feeling. The best way to go about that is to ask, especially a young person, tell me what you would do if someone you knew really closely was thinking about this. And when they see that you respond in a non-judgmental, level-headed way, they'll feel more safe in expressing when and if they might feel some of those feelings themselves.
Such an important conversation to have. Mitchell Prinstein, thank you so much for joining us.
Thank you.
And if you or someone you know needs help, the National Suicide Prevention Lifeline Network is available 24 hours a day, 7 days a week. You can call, text, or chat their hotline using the 3-digit number 988.